So the study was testing a new paradigm for the treatment of glioblastoma, an incurable brain tumor, where instead of using large margins and doing a single radiation plan, we used an MR-Linac, which is a machine that can do MRIs every day just before radiation, to reduce the margin that we treat and to adapt as the tumor evolves over 3 or 6 weeks of radiation with chemotherapy. So the study design was it's a phase two single arm study with two cohorts, again, 3 or 6 weeks of radiation, and all patients were treated with this new approach where they were treated with adaptive radiation on an MR-Linac. And the primary outcome was to look at the risk of marginal failure, because when we reduce margins, we worry that there's a chance that the margins are too small and the tumor will start regrowing at the edge of where we treated because we're smaller than the historical margins that are used. So the study was testing the safety of this approach to lead to more trials down the road that may test how much better it is in terms of toxicity. So the results were quite encouraging. Overall, we were testing against a historical rate of marginal failure where tumor regrows at the edge of the radiation volume of 11% in other studies with standard margins. And in fact, in our study, the risk of marginal failure was only 4%. So it was deemed non-inferior and therefore safe. And we also looked at outcomes like progression-free survival and overall survival compared to sort of recent contemporary historical controls. And again, there was no detriment in terms of outcomes like PFS and OS. I think it's really going to open up the doors for us and other centers to keep pushing forward with this approach. I mean, adaptive radiation is one of the new things that now that the technology has caught up to what we want to do, which is really personalize radiation even more, where we can personalize the treatment to tumors as they move or as they change or as they grow, as they shrink. And so I think it's encouraging for us as we're already continuing additional trials, and other centers hopefully will also start testing out this method to really define what the true clinical benefits are, which we believe are there and are real. But the safety signal in this study is the first step needed to encourage other places to start trying this approach.